Hi everyone, this is Neel Raithatha, consultant audiologist and director of WAXscope. Thank you for joining me in this demonstration video of our very soon to be launched WAXscope. This is actually of a procedure I performed on my business development manager, Dharmista, who's very happy for me to discuss her symptoms and her case in particular. Now, Dharmista is going through menopause, and one of her main symptoms is really dry, itchy ears. And with menopause, you have a reduction in estrogen, which is a hormone, and that reduces the amount of collagen in your skin. And the collagen in your skin helps the skin to remain smooth. So, in the absence of collagen, you can get a really bumpy, a rough surface of skin. And also, it reduces the skin's natural oil production. So, in the ear, we've got both sebaceous glands, which secrete sebum, which is a lipid, oily secretion, also found in our scalp, and it's made up of organic compounds such as cholesterols, alcohols, squalene, esters, long chains of saturated and unsaturated fatty acids. And also within the ear, we have ceruminous glands, which secrete cerumen, which is an oily sweat. The same oily sweat we also find under our armpits and groin region. So if you're suffering from menopause or perimenopause, the reduction in estrogen can reduce the collagen content in your dermis layer of skin, and also the less secretions of the natural oils, which there are two in the ear. And without the oils being secreted in the ear, these oils, they sit on the surface of the skin and they're hydrophobic. So they do two things. They expel external water that may enter the ear, which we don't want, but it also helps the skin retain its internal moisture. Without these oils sitting on the surface of the skin, the moisture, the internal moisture of the skin rises to the surface of the skin and evaporates. So that's why these oils, these moisturizers are really, really important. And it is a symptom that anecdotally I came across amongst many women who I treat at the clinic, and it was just too much of a coincidence of the number of female patients I was seeing reporting itchy, dry ears, and I just so happened to ask one of the patients if they're going through menopause, and then it soon dawned upon me there's definitely a causal link there. Now, I've decided to use the WAXscope, and the reason for that is these are the really tricky conditions where the WAXscope needs to be put to the test, really, when you're removing and peeling skin directly off the eardrum. So it's a completely different view to the endoscope, and the reason for the development of the WAXscope is a lot of people can find using an endoscope difficult. It is quite a skillful technique to acquire and master, and so what I feel is lacking if people are not able to use the endoscope, what's the next best alternative in the market? And I think there's a big gap there. You've got ENT operating microscopes, which are of course fantastic, but they weigh a ton, they're not portable, and they're very expensive. You've got head microphones. There are some decent ones out there, but I've used them before, and it's my personal opinion, I would really struggle to perform a procedure like this using head microscopes. And they're very difficult to retain focus. The slightest head movement from the patient or even yourself, slight movement, you lose focus, and you don't get the magnification like you are getting here. So that's the reason for the WAXscope. And the view that you're seeing is very similar to an ENT operating microscope. The difference with an ENT operating microscope that you get depth perception via binocular vision. With the WAXscope, because you're viewing it on a 2D screen, your depth perception is by focus. There's a misconception that you can't obtain depth perception via 2D vision. That's not necessarily correct. I mean, I use the endoscope all the time, and that's a 2D view that I've got, and I feel like I've got very adequate depth perception. You just acquire it in a different way. You acquire it through a process called monocular vision. So you use focus, contours, distinct markers in the ear, motion parallax. So motion parallax is, imagine you're on the motorway or highway, and the cars adjacent to you on the fast lane will whiz past you, but objects in the distance will go slower. So it's that comparative difference between the speed of objects near to you and far to you, which can also give you depth perception. So just, you can see the fine, and I've curled the end, and I'm just peeling this really last layer of skin. And with the WAXscope, one thing with the WAXscope I have noticed, it does give you a really good view of keratin and dead skin. So we've removed all that. You may have noticed right at the beginning of the video that Dharmista had really loads of dry skin flakes. So I have advised her to use some medical grade olive oil spray on a regular basis, just to help if your body's not producing these natural oils anymore due to menopause because of the lack of estrogen. You can use some medical grade olive oil to help to replace that. Well, I hope you enjoyed that video, guys. The WAXscope is coming very soon. We're just waiting for the app which is being developed. So take